Hi, I'm Melissa Belk. I'm a nurse practitioner here at Mercy Facial Plastic Surgery. I have Sonia in the office today, and we are going to review a treatment plan. Sonia, what brings you to the office today?
Well, I'm here because I'm starting to see the age in my face. So I'm starting to get a lot of lines, some sagging, and I'd like to look younger.
A little more refreshed. Okay. The lines in your forehead, brown, crow's feet.
Yeah, lines here and lines here and alongside of my mouth. It gives me a little bit of lines here too.
Okay. So the lines that you notice here and across, maybe across here, you didn't say anything about these, but here, here, and here, I can address with neuromodulators. And neuromodulators are injected into a muscle to soften them to decrease the dynamic lines. So you have less rest lines and the lines are softer when you move. Okay. So it helps keep you from maybe scowling, and then it relaxes that muscle so the line at rest kind of disappears. So it's great to hit this muscle. You know, no one wants to scowl or look like they're scowling. So I can put a lot of neuromodulators in that, and
It looks like I'm scowling.
yeah,
So I'm not.
right, exactly. So when you relax that, it can help open up your eyes and relax and just open up that area in general. Your forehead, that muscle is the only muscle that raises your brows. You've got a great arch to your brow, but you're having just a little heaviness in your lids. So if I were to put too much in your forehead to relax those lines, it could potentially drop your brow unless I offset that by relaxing some of the opposing muscles. So I could put the neuromodulators around here to relax this to open up your eyes, and also inject into your forehead to soften that as well. I don't particularly recommend on you to have that completely frozen. It would be nice for your forehead to still move a little bit, but the less movement that you have, the less the lines will become etched.
Okay. It looks less natural.
Yeah,
I
yes,
definitely want it
yeah,
to be
right.
natural.
So if I just put maybe a little less than recommended dosing on you, that would just help keep your brows elevated and your eyes open. And putting a little bit of neuromodulator here will help maybe give you a little chemical brow lift on the side. So that's how you address those lines here. The lines around your mouth and some of these lines and the jowling, there's maybe a multi-modality approach here. Some of the lines around the mouth are related, they're very similar to this, they're dynamic lines. So I could put a little bit of neuromodulator, but you have to be careful there because if you put too much, your mouth doesn't move right, so it doesn't look very natural. Some of the lines, what you just did, your facial movement, is you've got depressor muscles that pull down. So you could put a little bit of neuromodulators down to help decrease that function of pulling down. And you can also inject the neuromodulators down here that allow, when those muscles are injected, it relaxes the muscles pulling down and it allows the muscles that pull up to be less opposed. So it helps bring your smile up or your lines to be less noticeable because of the opposing function. But this here is more related to structural issues, not issues per se, but as we age, everything just kind of starts getting longer and sagging here. I can support that. You know, you have ligaments in your face that are like a hammock, and to support that structure, you know, you're thin and fit, so you have a loss of fat in your face. So just putting a little bit of volume, like fillers, like HA fillers, to your cheeks and maybe even mid-cheek region, possibly even the mandible, and even giving a little bit of filler to your chin to give it more projection can really clean up the appearance of that sagging and change the shape. It kind of redrapes your face, your skin, so your face is more, more round at the top instead of round at the bottom. I'd want to be careful not to overfill your face because you're very small, your face is small, so you wouldn't want, you know, a whole lot of volume. You just want to be more balanced. It can soften. If you look in the mirror, do that face again. So some of that is a muscle function. The orbicularis oris, which is the muscle around your mouth, creates some of those dynamic lines. A lot of times they're very pretty, so you can leave them, they don't necessarily pull down. But if I can soften them with different approaches, I can actually inject some filler around the corner of your mouth and some neuromodulators around your mouth. And with the cheek filler, it can soften some of those lines without changing the way your mouth moves when you smile. So it's kind of interesting what I can do with some needles.
So you talked about the different areas. Would you do that all at once, or is that too much at once?
So most of the time I can do it in one visit, but other times I need to add a little bit more, maybe a month later.
Okay.
Yeah.
And then how long does it take to heal up where I can go out on the town?
Go out on town. So generally you would want to wait till the next day. You look a little bit swollen, possibly the next day or so, but overall it's pretty
Not very noticeable.
not very noticeable.
Okay.
Yeah. Well, if that all sounds good to you, we'll get started.
Sounds really good.
Awesome.